Hello, welcome back to another video. In today's video, we are going to talk about necrosis, a very important aspect of pathology and a very fundamental topic as far as cell death is concerned. So after our previous video where we talked about cell injury, the first type of cell injury that we are going to talk about is an irreversible cell injury, which is necrosis. So irreversible cell injury is also called cell death, and there are two types of cell death. We have necrosis and apoptosis, but today we will focus on necrosis. So what are we going to be talking about today? We will be talking about the definition of necrosis, the morphology of necrosis, the different types of necrosis, the causes of each of those types of necrosis, the mechanisms, and last but not least is the examples of necrosis. So this is going to be our general outline for our topic today. Let's dive deep into it. So, for us to understand the concept of necrosis, it is very important for us to look at a bigger picture as far as necrosis is concerned. What is the cause of this necrosis? How did this necrosis come about? So, we know that a cell, if a cell is being subjected to a stress, and the stress can either be physiological or pathological, the cell is going to undergo cell adaptation. And if the stress continues to persist, the cell will now be injured. And the injury can either be reversible or irreversible. Reversible meaning that if the stress is removed, the cell is going to go back to its original form. And irreversible meaning even if the stress is removed, the cell has already died and the cell cannot go back to its original form. So that is what we call an irreversible cell injury. And an irreversible cell injury is also called cell death. And there are two main types of cell death. We have apoptosis, which is the programmed cell death, and necrosis, which is an inflammatory form of cell death. But in our today's video, we are going to base on one of the concepts of cell death, which is necrosis. So what is necrosis? How do we define necrosis? We said necrosis is an accidental, unregulated, and inflammatory form of cell death that results from the damage to cell membranes and loss of ion homeostasis. So these three words are very important as far as the definition of necrosis is concerned. That is accidental, unregulated, and inflammatory. These are the differences, or these are the words that will help you to differentiate between necrosis and apoptosis. Necrosis is accidental, unregulated, and inflammatory form of cell death that results from cell membrane and loss of ion homeostasis. So that is the definition of necrosis. So what are the changes that we see in a cell undergoing necrosis? So we have two main types of changes. The first change is the cytoplasmic changes. So the cytoplasmic changes are one, increase in eosinophilia, meaning the cytoplasmic membrane or the cytoplasm is going to be more eosinophilic, it's going to be more pink. So that is one of the cytoplasmic changes that takes place in a cell undergoing necrosis. And the other type of change is called the nuclear change. So there are two main types of morphological changes in a cell undergoing necrosis. The first one is the cytoplasmic change, and the second one is the nuclear change. So what are some of the nuclear changes that take place as far as necrosis is happening? These three concepts are very, very important, and I would like you to pay attention to it. The three main changes are pyknosis, karyolysis, and the third one is karyorrhexis. So what is pyknosis? What is karyolysis? And what is karyorrhexis? Pyknosis is the shrinkage of the nucleus, which appears shrunken and deeply basophilic. So the shrinking of the nucleus is what we call pyknosis. The second one is called karyolysis. It's the fading of the basophilic staining of the nuclei. So the nuclear is going to start to fade, and the fading of the nuclear is what we call karyolysis. And the third one is karyorrhexis, which refers to the breaking down of the nuclear into smaller fragments. So knowing this description of the nuclear changes are very high yield for your exams. So just to double down on what I was trying to share here, the cytoplasmic changes and the nuclear changes. If you look at the cytoplasmic changes, we have the normal cell. And in a necrotic cell, the normal cell become more eosinophilic. It became more pink due to the loss of the RNA and denaturation of the proteins. And if you look at the cytoplasmic changes, or the nuclear changes, we have pyknosis, karyorrhexis, and karyolysis. Pyknosis, the nucleus shrink. That is the shrinking of the nucleus. If you look at the normal nucleus here, and the nucleus on the pyknosis, the nucleus shrunk in size. So the other one is karyorrhexis. Karyorrhexis, as I said, is the breaking down of the nucleus into smaller fragments. If you look at the normal cell under karyorrhexis and the cell undergoing karyorrhexis, you will realize that the nucleus was broken down into several smaller fragments. And karyolysis, as I said, is the progressive fading of basophilic staining of the nucleus, which leads to a ghost nucleus. So the fading of the basophilic staining of the nucleus is what we call karyolysis. So it is very, very important for us to pay attention to the cytoplasmic and the nuclear changes. So now let's talk about the different types of necrosis. But for us to understand the different type of necrosis, it is very fundamental for us to know these three main descriptions. The three main descriptions are the architectural detail, the cytoplasmic detail, and the nuclear detail. The architectural detail is talking about the plasma membrane, the cytoplasmic detail talks about the cytoplasm, and the nuclear detail talks about the genetic contents that are found inside the cell. So knowing these three fundamental descriptions are very, very important for us to know the different types of necrosis. What are they? The architectural detail, the cytoplasmic detail, and the nuclear detail. So the patterns or the different type of necrosis. There are different types of necrosis. What are they? 1. Coagulative necrosis, liquefactive necrosis, caseous necrosis, fibrinoid necrosis, fat necrosis, and the last but not least is called gangrene. So these are the types of necrosis: coagulative necrosis, liquefactive, caseous necrosis, fibrinoid necrosis, fat necrosis, and gangrene. So we start with the first one, coagulative necrosis. What is coagulative necrosis? You see, coagulative necrosis is a type of necrosis. First of all, we know that it is the most common type of necrosis that occurs when the architectural outline passes, but the cellular and the nuclear details are lost. So in my previous picture, I told you to pay attention to the architectural outline, the cellular outline, and the nuclear outline. The cellular outline is just like the cytoplasmic detail. So in coagulative necrosis, the architectural outline persists, that is, it remains, but the cellular and the nuclear details are lost. So the definition of coagulative necrosis is, it is a type of necrosis that occurs when the architectural outline persists, but the cellular and the nuclear details are lost, leading to the formation of a ghost or tombstone appearance. So the characteristic feature of cells undergoing coagulative necrosis is the formation of ghost or tombstone appearances. Now let's talk about the causes of coagulative necrosis. One of the most common cause of coagulative necrosis is ischemia of organs. So ischemia of all organs leads to coagulative necrosis except the brain. This is very high yield. Ischemia of all organs lead to coagulative necrosis except the brain. Ischemia of the brain leads to liquefactive necrosis, which we are going to discuss later. So ischemia of the brain and also mild burns are some of the causes of coagulative necrosis. What is the mechanism? How does coagulative necrosis occur? The mechanism for coagulative necrosis is ischemia, which denatures and coagulates structural protein. So because of ischemia, which is decreased flow of blood to an organ, can cause the structural proteins and enzymes to coagulate and denature. So that is the mechanism of coagulative necrosis. So just to double down on what I was saying about coagulative necrosis, I told you it is a type of necrosis where the architectural detail persists, but the nuclear and the cytoplasmic details are lost. If you look at this cell under the normal tissue, they have the architecture is there, that is the outline, the cytoplasmic details are still there, and the nuclear details are still there. But under coagulative necrosis, only the architectural outline passes, both the nuclear and the cytoplasmic details are lost. So this picture is trying to show you that coagulative necrosis is a type of necrosis where the architectural detail passes and the cytoplasmic and the nuclear details are lost. Let's now move into the second type of necrosis, which is liquefactive necrosis. What is liquefactive necrosis? Liquefactive necrosis is a type of necrosis where the architectural, cytoplasmic, and the nuclear details are all lost. So here, instead of the architectural detail persisting, both three of them, the architectural, the cytoplasmic, and the nuclear details are all lost. So that is the definition of liquefactive necrosis. What is formed? In liquefactive necrosis, a semi-fluid material is formed. On the coagulative necrosis, we said a tombstone cells are formed. But here we have semi-fluid materials are formed. What are the causes of liquefactive necrosis? I told you ischemia of the brain is the main cause of liquefactive necrosis, and also infections by pyogenic bacteria can also cause liquefactive necrosis. What are the mechanisms of liquefactive necrosis? Liquefaction is due to digestive actions of the hydrolytic enzymes released from dead cells. So these dead cells that have undergone liquefactive necrosis produce digestive hydrolytic enzymes which are released, which causes liquefactive necrosis. So liquefaction is due to the digestive action of the hydrolytic enzymes released from dead cells. This is just a diagram showing liquefactive necrosis where the architecture, the cytoplasmic and the nuclear details are all lost. So here we have a normal cell, that is example is the brain, and the cell undergoing liquefactive necrosis where the architecture, that is the plasma membrane, the cytoplasmic and the nuclear details are all lost, and the cell will turn into a semi-liquid form. Hence, we call it liquefactive necrosis. We now go to the third one, caseous necrosis. What is caseous necrosis? Caseous necrosis is a type of necrosis where the architectural, cytoplasmic, and nuclear details are lost. Here also, both three fundamental descriptions are lost. That is the architecture, the cytoplasmic, and the nuclear detail. But there is something that is formed. And what is that thing that is formed? Caseous necrosis leads to the formation of a cheese-like amorphous debris. This is very important description. A cheese-like amorphous debris is formed. Hence, we call it caseous necrosis. It is a type of necrosis where the architecture, the cytoplasmic, and the nuclear details are lost, leading to the formation of a cheese-like amorphous debris. What are the causes? It can be caused by Mycobacterium tuberculosis, syphilis, histoplasma, and coccidiomycosis. These are the main causes of caseous necrosis. If you look at the diagram here, there's the normal tissue, a cell undergoing caseous necrosis, that is the microscopy, and the gross appearance, this is how it looks like. Cheese, if you look at cheese appears to be like something that is white. So the formation of a cheese-like color leads to the formation of caseous necrosis. So that is a high yield description of caseous necrosis. Now let's talk about fat necrosis. What is fat necrosis? Fat necrosis, this is a special form of cell death occurring in fat-rich anatomic locations in our body. In our body, we have certain parts of our body that contain high amount of fat. Example of those areas are the omentum, the pancreas, and also the breast of females. These are the fat-rich anatomic locations in our body. Hence, fat necrosis occurs in them. And one high yield thing for you to know is the yellowish white firm deposits are formed under fat necrosis. If you look at this picture here, you will see yellow and white deposits. These yellow and white deposits are the hallmarks of fat necrosis. And where does fat necrosis occur? In fat-rich anatomic locations. Example, the omentum, the pancreas, and the breast in females. And what are the causes of fat necrosis? Acute pancreatitis, inflammation are the main causes of fat necrosis. The next one we have is called fibrinoid necrosis. What is fibrinoid necrosis? Fibrinoid necrosis is a type of necrosis which occur in fibrin-rich material is deposited on the intima of blood vessels. So on a blood vessel, we have what we call the externa, we have the media, and the interna. These are the three layers of the blood vessels. So the intima is the internal layer of the blood vessel. So when fibrin-like materials is deposited on the intima of blood vessels, this type of necrosis is called fibrinoid necrosis. What are the causes of fibrinoid necrosis? One of the main causes of fibrinoid necrosis is vasculitis. Vasculitis is one of the main causes of fibrinoid necrosis, and polyarthritis nodosa is also another cause of fibrinoid necrosis. Malignant hypertension is also another cause of fibrinoid necrosis. So this is a diagram showing fibrinoid necrosis, a blood vessel where the fibrin-like material is deposited on the intima of blood vessel. Now let's talk about the last one, which is gangrene. What is gangrene? Gangrene is a massive necrosis with superadded putrefaction. Putrefaction refers to the decomposition of a substance with the help of bacteria. When bacteria decompose a particular substance, we call it putrefaction. So when necrosis is superadded with putrefaction, the term is called gangrene. There are different types of gangrene. The three main types of gangrene we are going to talk about is dry gangrene and wet gangrene. And we also have what we call a gas gangrene. But gas gangrene is a variant of wet gangrene. So the two main types are dry gangrene and wet gangrene. And gas gangrene, it is a variant of wet gangrene. So what is dry gangrene? Dry gangrene is a type of gangrene where we have less bacterial superinfection and tissues appears to be dry, as the name implies. But under wet gangrene, abundant bacterial superinfection and tissue looks wet and liquefactive. Gas gangrene, it is a variant of wet gangrene caused by Clostridia. A very high yield exam question. What is the name of the bacteria that causes gas gangrene? Gas gangrene is caused by Clostridia, and Clostridia is a gram-positive anaerobic bacteria. Let's start with the first one, dry gangrene. A dry gangrene is caused by arterial occlusion. If the arteries inside our body are occluded, most of the arteries that are found in our limbs, if they are occluded, they can cause dry gangrene. What are the features of dry gangrene? Dry gangrene, it usually involves the limbs, generally the distal parts of the limbs, example, the legs, the foot, and the toe. Dry gangrene is predominantly consists of coagulative type of necrosis. So dry gangrene, it is a type of coagulative necrosis. It is a very common high yield exam MCQ. Dry gangrene is predominantly consists of coagulative type of necrosis. Also, affected part is dry, shrunken, and also dark brown or black, resembling the foot of a mummy. So mummification, it's a high yield hallmark of dry gangrene. And the last but not least is there is a line of demarcation is seen between the gangrenous and the adjacent normal area. Meaning if an organ is having dry gangrene, you can be able to differentiate between a part that is having gangrene and the part that is not having gangrene. We will see it in the next picture here. Here you have a black, dry, shrunken necrotic tissue is seen. That is what we call mummification. A well demarcated line between the normal and the gangrenous area. So if you look at the other part that is not having gangrene and the black part that is having gangrene, there is a line of demarcation that differentiates between these two parts. And the third one is no infection, no discharge, tissue is dry and hard. So these are the characteristic features of dry gangrene. Let's talk about wet gangrene. Wet gangrene is caused by venous occlusion. Common differences between dry and wet gangrene. Dry gangrene is caused by arterial occlusion, while wet gangrene is caused by venous occlusion. What are the features of wet gangrene? Wet gangrene, it usually involves the bowel, while dry gangrene involves the limbs. Wet gangrene predominantly consists of liquefactive type of necrosis, but we said dry gangrene consists of coagulative type of necrosis. The affected part is soft, swollen, putrid, and dark. Here, in wet gangrene, there is no clear line of demarcation between the gangrenous part and the adjacent normal area. Let's look at the picture here. The swollen, moist, foul-smelling tissue is formed. Blister post-discharge is formed, and severe pain, initially later numbness. So here, there is no clear line of demarcation between the part that is having gangrene and the normal area. So this is what we call a wet gangrene. It is a type of liquefactive necrosis. Now let's talk about the differences between dry and wet gangrene. Based on our features, we can be able to give the differences now. Obviously, we said that under dry gangrene, it is commonly found in the limbs, while wet gangrene is commonly found in bowels. Dry gangrene causes arterial occlusion, while wet gangrene is caused by arterial obstruction. This is caused by arterial occlusion. This is caused by arterial venous obstruction, combined venous and arterial obstruction. But the main one is venous obstruction. This one is the bacteria fail to survive. There is less amount of bacteria here. The numerous bacteria are present. On the dry gangrene, we have limited putrefaction, whilst on the wet gangrene, there is marked, that is organ engulfed with blood. There is high amount of putrefaction. Microscopic, it is dry, shrunken, and black. Whilst in wet gangrene, we have moist, soft, and swollen. Line of demarcation is present in dry gangrene as we illustrated, whilst line of demarcation is absent under wet gangrene. Prognosis is better, prognosis is poor, and it's a variant of coagulative necrosis, that is dry gangrene, and wet gangrene is a variant of liquefactive necrosis. So most of our university exams, we will be asked to state 5 differences between liquefactive necrosis, between wet gangrene and dry gangrene. So these are the differences between dry gangrene and wet gangrene. Outcomes of necrosis. What are the outcomes of necrosis? If necrosis happens, what are the things that are formed? 1 is the formation of cyst. 2 is the scar formation. The third one is self-mutilation, and the fourth one is ossification, which is the formation of bone. So these are the outcomes of necrosis. So we have come to the end of the video. Please endeavor to comment and subscribe. Thank you very much.